Further debate, the member for Hamilton Mountain.
Thank you, Speaker. I'm pleased to speak to this bill, an act to require research to be undertaken and programs to be developed for pregnancy, loss and infant death, and to proclaim October 14th as Pregnancy and Infant Loss Awareness Day. I thank the member for Eglinton Lawrence for bringing it forward. Losing a child is an unimaginable pain, whether that loss is at infancy, at birth, or before term. It leaves a parent missing a piece of something so precious that should have been. A loss of a dream and the joy that was felt when they learned that they were bringing a new life into our world, and the thoughts of the possibilities that the future held. A family close to me was touched by such a loss at full term. It was a horrendous time. The nursery was ready, the shower had happened, everyone was excited and waiting for this wonderful gift that would be joining their family. But that excitement came crashing down as things went horribly wrong very quickly, leaving extreme emotional destruction in its path. This is just one experience that I'm very familiar with. The Pregnancy and Infant Loss Network reports that 1 in 5 pregnancies in Canada end in miscarriage, and that in Canada, 6 of every 1,000 births are stillborn. 37,000 families across Ontario experience pregnancy and infancy loss each year. Those parents deserve and require support and understanding during their time of grief. And that is what this bill aims to do. By amending the Ministry of Health and Long-Term Care Act, this bill would add new duties and functions to the minister. In addition to those duties and functions already in place, passage of this bill would require the minister to establish research initiatives and programs, undertake analysis to look and understand what contributes to pregnancy loss and infant death, develop programs to reduce the risk, provide counselling and support to families affected by these tragedies, and undertake research into the best practices of other jurisdictions. It's hard to argue against the Minister of Health being required to put all of these items in place, and I wouldn't want to do that. They are all needed. And there are many things that the minister should be required to do when it comes to the delivery of health care in Ontario. The lack of services for people with mental health problems has been spoken about often in this chamber. Earlier this year, I was taken on a tour of a few homes operated by the Good Shepherd in Hamilton, a transitional house where youth between 16 and 20, some of them dealing with mental health issues, learn life experience and skills and learn how to cope. A residential home for youth and supporting families who need support and tools to keep them to deal with their mental health problems, trauma, and conflict resolution. A shelter for homeless and street-involved youth, which provides 20 beds as well as on-site access to mental health professionals, a physician, a nurse practitioner, as well as youth support workers. Thanks to the dedicated staff of those workers and their own fundraising efforts, they manage all of this with government funding of $44 per day. They're terribly underfunded, and in fact, they have 1.6 mental health clinicians to service all of Hamilton. Children's Mental Health Ontario reports that 6,000 kids are waiting a year for mental health. We hear often of cuts to our mental health services as well as other health care. I hear it regularly from constituents. The member from Nickel Belt has spoken about the loss of 87,000 hours of nursing care in Health Sciences North. I appreciate what the member of Eglinton Lawrence is trying to do with this bill, and I support him in this cause. Pregnancy loss and infant death is an exceptionally traumatic experience that does not get the attention that it deserves. Dee Ferguson is quoted on the Pregnancy and Infant Loss Network's website as saying, and I'll quote, "How very softly you tiptoed into my world, almost silently. Only a moment you stayed, but what an imprint your footprints have left on my heart." End of quote. It's very easy to underestimate the impact these events can have on mothers, fathers, and the entire family, but I think this quote really brings it home. This bill also serves as a reminder of where the government is failing to provide services right across the entire mental health sector. The bill will also establish October 15th each year as Pregnancy and Infants Loss Awareness Day in Ontario. This date is already recognized in the US, parts of Canada, Australia, the UK, and it was previously brought forward to this chamber by my colleague, the member for Hamilton East Stony Creek. I think it's fitting that we make this declaration now in Ontario. Again, I thank the member from Eglinton Lawrence for bringing this bill forward and hope that we can pass it through committee and make sure we get this work done.